And let's hope there's no bad weather here today, Natalie. So we're gonna be good.
Yeah, it's very sunny in Kingston as well.
Last week was a disaster somewhere. It was awful. My internet wouldn't hold. It was just
Uh,
anyway.
that's always like, technical problems. They can always crop up at the most inopportune time.
I know, right?
I know.
Awful, awful. Okay, let's get started somehow since I know that you are on a tight timeline here. So today we are talking with Dr. Summer Lopez, and I did not realize you were Dr. Summer Lopez until I was fishing you out online. But we're talking with you. I'm going to let you introduce yourself. But today's topic is around physiotherapy, Pilates, that general stuff around menopause. So
Sure.
go ahead and introduce yourself, and then we'll jump into some juicy questions that we have for you.
Sure. Okay. Hi, everybody. My name is Summer. I'm a physical therapist and a Pilates instructor for the last 24 years. And our clinic is in Kingston, Body Forte, and we work with a large population of our clients are women in this phase of their life. And so as we kind of dive into today's topics, we can talk about, what we work on with them and what their concerns are. So yes, I am a proponent of movement. I love just helping people feel like themselves, whatever that self is, as we know that's changing. And I have to say, I love the name of this, this chapter 2 Unleashed, because it is a chapter 2. And I think it's really great and really important that we look at it that way, not that it's not an end, it's a new beginning. So that's very cool.
Absolutely. Thank you so much. Oh, absolutely. Chapter 2, we're just starting, ladies, definitely. Okay, so physical therapy, as we know, is not really the first place we think when we look to facing our issues of menopause. So when I was doing some research for this, I was very, very surprised of how physical therapy and Pilates can help us through. So with all the issues that women are facing in menopause, I mean, we go from weight gain to frozen shoulder, which is kind of bizarre. What other conditions can physiotherapy help with on this journey of menopause? Because the list, when I was looking at the list, there's 66 symptoms that I read.
Right.
66. Right. I was like, are you freaking kidding me?
Well, yeah, there are a lot of different ways, but as Dr. Christiane Thorpe says in her book, The Wisdom of Menopause, this phase we're becoming the queen of self. That's what she phrases it as, we're becoming the queen of ourselves. So women in this phase hopefully have, their kids are a little older, they have a little bit more time for themselves, their brains and their bodies are being rewired in many great ways too. We tend, not we, but some people can tend to harp on the negatives, the hot flashes and the aches and pains and the weight gain, but there's so much other great stuff going on too. Our intuition, the way we can, focus and take on new and different challenges. So I think in terms of Pilates, I think that's a really nice form of exercise, because that is like, it's not going to be a workout that depletes you. It's going to be a workout that kind of re-energizes you a little bit, has a lot of that mind-body connection. So, you can't be thinking about, oh, I didn't sleep well last night, or oh, I've got to go to the grocery, or, oh, you have to be, it's like a moving meditation. You have to be very present when you're doing Pilates, which is nice. So yeah, I think that's definitely a benefit. Another big, huge thing for women in menopause is bone density. So that's a huge thing. And I would recommend everybody who is, in menopause. I started menopause very early. I'm 46. So I've been in full menopause since I was 43.
Whoa.
Yeah.
Wow.
So to have your bone density checked, because we lose a lot of muscle as soon as we hit menopause. So before menopause, women need to be doing everything they can to build that muscle, and then at and after menopause, doing everything we can to maintain that muscle. So of course, physical therapy and Pilates will also, are one of the tools that can help with that as well.
Can you dive a little more into that, Summer, in terms of how does Pilates and physical therapy help with bone density? Because we know menopause, there's bone density issues, there's cardiovascular issues go on the rise, and of course, impaired balance, change in body composition that you were alluding to a while ago. How does what you do in terms of Pilates and physical therapy, how does that play a role in preventing some of those things? So,
well, for physical therapy, that's a little different than Pilates because physical therapy is more targeted. We're working with our patient one-on-one to their needs. So, for instance, somebody who has been diagnosed with osteopenia or osteoporosis. So osteopenia is the phase when it's the precursor to osteoporosis. We're going to educate them on a lot of things, and even the way you get in and out of bed, even the way you put on a pair of underwear, because certain positions are now contraindicated for that population of people because it puts them at greater risk for fracture. So I mean, we have a lot of ladies who come to us, with their bone density report, which we have said, we think you should get this. They come, they're shocked, and they've been, in the gym or even maybe in a yoga class or a different Pilates class doing sit-ups, which is contraindicated for somebody with osteoporosis. So it's a lot of education and teaching them what not to do, what to do, and then giving them a prescription as to kind of how to load and how to lift and how much weight they should use, that type of thing. So that's how we would guide somebody in physical therapy. And then as it pertains to Pilates and bone density, we have classes specifically geared for bone density. So that is with one of our teachers who is, certified in that. So they work on a lot of, jumping and impact, help with bone, heavier weight. So in addition to the springs that we will use on the apparatus, we will use the springs and some handheld weights for those classes, just to kind of load that group of people a little bit more and a little bit differently. And of course, like you said, Natalie, work on balance, because we don't want them to fall. If you've got osteoporosis in your hip or your spine, we want you to have really good balance so that we can avoid those falls.
Yes. I'd love to know how you're supposed to put on your underwear properly.
Yes, me too.
You're not supposed to bend over like that. You're supposed to maybe, if you have poor bone density, you have to hinge. You have to, if you're really good and have good balance, hinge and stand on one leg, which is pretty hard, or sit and put one foot at a time. But it's the flexion. And, think of how many times you flex a day. It's not just putting on your underwear. It's, so how many times we bend anything. Yeah. How many times we bend in the day. So it's those repetitive motions over years and days that will start to lose. And that's why you see some of those ladies with that, that flexed upper back, because of density.
So my question is, I'm sorry to belabor the point on the bone density, because I think it's really important in menopause is, so are we all to be walking around assuming that we should all go and have our bone density done, or is there signs or symptoms that we can look for? Do we need to come to you and you say, listen, what do we do?
Great question. There is definitely, there's kind of there's a look there's a look which is usually very thin, fine framed. People are usually at greater risk for osteoporosis. So for those people, we definitely say yes. It's also more predominant in Caucasians as well. So that plays a factor. So there are many different factors, but it's always a good thing to get when you go into menopause. And I would suggest it. I mean, I would say it would be a great thing to do. And then if you go and you have a great bone density test, you're like, yeah, I don't have to go back for a while. But if you're kind of on the borderline, then you want to start taking action quickly.
Very good. Definitely. I have never done one, so I think I would be making an appointment.
Yeah, you should.
Definitely doing that after here. So let's talk a little bit about icky joints. We have pelvic pain because, the pelvic pain in menopause, I mean, I went through some of it. It almost reminded me a little bit of like when you're giving, when you're pregnant and your
Mhm.
hip bones everything is shifting and changing and stuff. It's almost similar to that. So we talk about drug-free treatment now because we're not doing, if you're not doing HRT or you can't do HRT, what are some drug-free treatments and you can do for the achy joints, for the pelvic pain, that
Right,
kind of stuff?
right. I know somebody came to me really excited. They're like, I hear there's this place where I can go sit on this chair and it's gonna like make my pelvic floor stronger and make it not hurt and make my incontinence go away. I'm like, well, that might be partly true, but it's not fully true. So what we know about the pelvic floor is it's like any other muscle, right? It's made of muscles. And having a healthy and functioning pelvic floor where we can, still feel good, experience pleasure, go to the bathroom, all those things that we want to continue to do for a very long time. It has a lot to do with even the way your feet function. If your back hurts, that's going to affect your pelvic floor. If you're restricted in a certain area. So there are some physical therapists who specialize in pelvic floor. So especially for incontinence or very painful sex, they will do like internal work, internal exams, and they have all these different tools and they can kind of test to see like what the internal muscles are doing and how they're firing. So that is a great part of it. What we do here at this office is we approach it from a more holistic point of view, because most of our patients that come in with pelvic floor problems are really worried that their pelvic floor is going to be loose and prolapse, but it's actually the opposite. It's actually really very hypertonic and tense, right? So you need, it can't be here, it can't be there. You need, somewhere in the middle. So teaching them, even breathing exercises, how to strengthen your hips, how to, activate your feet, people that have a lot of plantar fasciitis, that type of thing, that's even tied to pelvic floor problems. So it's all very, very, very interconnected and really, really interesting, actually. So that's a good question with that. It's not a yes or no answer, but there's so much, it should spark lots of glimmers of hope because there's so much that can be done for it with great success. Yeah.
That's very interesting.
Yeah.
The more people we talk to, the more things are just coming up out of nowhere that's starting to like come together and make sense. And I really hope that our listeners, those that are on now and watching the replay, are appreciating this as well. So like I had no idea that plantar fasciitis could somehow be tied in to pelvic floor issues, but I guess because the fascia connects everything and everything starts with your feet. I mean, it makes sense,
Yeah.
So and then the other thing is we tend to associate incontinence with women that have had children and are getting older. And then we also, but I never put the connection between, that means menopause and incontinence, So there are exercises right now that we should be doing that would be strengthening that pelvic floor.
Right. And those exercises have gone so far and beyond Kegels. Like I don't think we prescribe Kegels anymore here at our office. It's always part of a bigger, more holistic, tie in the hips, tie in the feet, tie in the breath, tie in the posture, tie in all those things. Yeah.
So when we think of incontinence, we think of leaking, right? But one thing that a lot of women that we talk to are experiencing is a need to wake up and pee. Now, that may be because sleep is not as deep. That may be because bladder muscles are not as strong. Like there's so many reasons why that recurring pressure to urinate in the middle of the night or an overactive bladder can start to act up, as it were. So do the non-Kegels help with the waking up at night? So if we're strengthening pelvic floor.
I am not sure. So I do not have wouldn't think my expertise answer that question, but I think, Yeah, I think maybe you're on the right track with if the sleep is not as deep, maybe that's why they could be waking up feeling like, oh, I think I need to go to the bathroom. But funny enough, that's also been happening to me. I don't know if it's so hot. I've been drinking way more water too. My gosh.
Yes,
Um,
yes.
but for sure, yeah, I was able, used to sleep the whole night through, and definitely, waking up to use the bathroom for sure once.
So if you say, okay, Kegels are out, not to say that Kegels are out, but if Kegels are not the only way to strengthen pelvic floor muscles, and you say that there are other things, you talk about posture and how you're holding yourself, is there like one exercise tip sort of thing that you could give us that we could start practicing in our everyday life to improve our continence?
That is a really good question. I would say probably not. Actually, yes, I would give an exercise. You want me to kind of show you? I would
Oh,
give
is that possible? Yeah. Okay.
yeah, I would give an exercise on your hands and knees, right?
Okay.
Yeah. And I would take, let's see if I can not dump my computer out, but I would on your hands and knees, and I would take one leg out to the side, kind of
Yes.
on the
Yes.
floor, and just do some pelvic rotations in that position. So that's going to get into all the deep adductors, all the inner thighs, everything that then kind of feeds up into that pelvic floor, and just being in that position and kind of rotating the pelvis back and forth. Like I set my timer and I'll do with my right leg out, I'll do a minute, and then I'll switch sides and do a minute. And that just, that kind of just takes the dial, the tone. Because remember, we said a lot of people, we're so worried about not having good tone, but so many of the issues are hypertone, right? So that kind of gets everything back to a nice medium neutral feeling and function.
Gotcha.
So that had some mobility, it had some rhythm, it had some stretching of the adductors. So that exercise checks a lot of boxes. Yeah.
Gotcha. So you're on your hands and knees, and then you take like one foot and cock it out to the side.
Yeah, and your toes are down, but your foot
are
is
down.
Yeah,
Okay.
your toe is down, your foot is parallel, and you're just kind of like a little pelvic tilt back and forth. Yeah.
Gotcha. All right, I'm gonna give that a try.
You could do a little video for us, Natalie, or we can post it on our Instagram.
Absolutely. No problem. We'll do.
Summer can do the video.
There you go. Okay, so we're talking about the pelvic floor and whatnot. So let us go into a topic that has come up for us in the past, and that is painful sex. So a lot of women don't want to talk about it. It's obviously very taboo, and there's a lot of shame around it. And we know that, your estrogen, when your estrogen goes down, it can cause the thinning of the tissue, which then leads to the vaginal dryness, the irritation, the pain during sex. Is there an exercise? Is there a therapy that we can do to help that flow or help that thing without the estrogen?
I mean, maybe Natalie, maybe there's something you can eat or a supplement. I'm not sure about that, but yeah, the definitely lubrication is a key.
Yeah. No, there's definitely supplements that can help. I was thinking maybe exercises that, like someone was saying, that help to relax that area, because
right. So
lubrication is one thing, but the painful sex comes from if things are in spasm, right?
Right. So that will definitely help. That will help a lot, but then you still need the, you still need the lubrication.
Yeah.
Well. Right.
Yeah. Well, that's very interesting. Okay.
Yeah.
I guess that's where we hear about that O shot that we should probably look into.
What is that?
The O shot?
Oh, I don't know about that.
Oh man, yeah. So there's a procedure performed by medical doctors. It's not like one of them things that you go and get randomly done somewhere, right? And it's supposed to restore blood flow.
Okay.
It involves injecting the clitoris and the labia with platelets. So I believe
like a PRP type of thing. Yeah.
It's like a PRP, but for your pookie.
We do,
for your PRP.
We do PRPs in other joints, right?
There you go. Yeah, so it's supposed to make your orgasms more powerful, but also improve the blood flow to the area. Although there is, according to Healthline, there's scientifically little evidence that it's going to improve your sex life. I guess that's that's up to you.
Right.
But it'll improve the functionality of you. But
Well,
yeah,
I learned something new.
there you
So
go.
did I.
I learned my plantar fasciitis can impact my continence, and you learned about O shots.
Yes,
This is
exactly.
why we do what we do, ladies. This is why we do
Abs-
what we do.
Absolutely, absolutely.
All right, let's talk a little bit about sleep.
Yeah.
This has been a big thing for me. In the past episodes, we've talked about supplements. And of course, for me, magnesium glycinate is my hands down my go-to sleep thing. But we do know that exercise, that does help with sleep. Let's talk a little bit about Pilates and that mind-body connection, as you talked about earlier, and helping with any kind of sleep issues, because that will also help with stopping us getting, as you said earlier, getting up to pee, which I know,
Right.
I kind of wake up, I'm like, do I need to pee? Yeah, I think maybe I should. I come back.
Maybe I
So
should go so I can get back to sleep better.
yeah, exactly. So let's talk a little bit about Pilates, and does that help with sleep?
I mean, I'm gonna put my head out, my whatever body part out there and say Pilates helps with everything, because it's not one of those workouts that's gonna deplete you, because you don't, sometimes you're too overtired or too wound up to go to sleep. It's going to help with aches and pains. So it's going to make you feel more comfortable when you're in bed. It's nothing worse than getting into bed and you're like exhausted. You're like, oh, my back is hurting, or my shoulder's hurting, or my neck is hurting, and I'm exhausted and I can't go to sleep now. So yes, Pilates is going to, and for those of you who have never done a Pilates class, it's about an hour-long class that just works on everything from flexibility to strength to balance and coordination. You're in various different positions that are going to be different to the positions that you get into if you go to the gym, or if, we kind of put you on your side, you're laying on your tummy, you're like in a variety of different positions. So that just allows your body to work in a variety of planes of motion. And that's going to just give you a very nice, complete, relaxed feeling. Everybody it's like, oh, I feel taller when I walk out, or they just feel, lighter, more relaxed. So I hope that would help with sleep. I mean, for me, I always try to get off of my electronics, a good half an hour, 45 minutes, and just try to, not be thinking about, oh, shoot, what do I have to do tomorrow? Or, that's kind of when my brain goes, or maybe at 3:30 in the morning.
Right. Summer, for those of us that don't know what Pilates is, can you give us a little, because you mentioned an apparatus and you mentioned springs, and this is conjuring up all sorts of images for some people that just don't know what Pilates is. So can you back up a little and give us an idea of what it is?
Sure. So Pilates is a system of exercise, just like yoga is a system of exercise.
Okay.
It was created first to be done on the floor with a mat, and then it evolved to have springs, and you can attach the springs to your hands, you can attach the springs to your feet, and the springs can either act as assistants. So say you have maybe an elderly client who is really deconditioned, very out of shape, very weak, and cannot really lift their leg very well, right? So we can adjust the environment of the Pilates apparatus to either have the spring assist them to lift their leg, or somebody like us, we're stronger, we want more work, so we can adjust the Pilates apparatus to make that spring work as resistance. So it's and that's what makes us so passionate, and why we chose to do Pilates-based physical therapy, because the environment is just so easy to adjust and will meet the patient or the client where they are. So yeah, so I think, sometimes new people walk in, they're like, oh my God, what is this? You know, this looks like a torture chamber in here. You know what I mean? I'm like, oh no, it's not. It's great. I would pop my head out there to show you guys, but there's a class going on right now. So yeah, but good question. It's if you haven't tried it, you should definitely try it.
Yeah,
Do
I
you,
recommend Pilates to so many people for so many reasons.
Thank you.
Such a
Yeah.
great, such a great addition to your repertoire if you
And that
already
was
have
what
a
I was
good.
going to say, you know, and nothing is the be all and end all. We need, you know, so I do Pilates twice a week, but I also lift weights twice a week. You know what I mean? It has to be balanced.
Absolutely.
Yeah.
yeah,
Absolutely.
no,
Absolutely.
customizing, do you do like customizing Pilates classes? I mean, you have different levels.
Right.
So if you've never started before, maybe you just start on a beginner, or
Right.
how does that work? Or do you have different classes that target different parts of your body, or is it an entire full body?
It's usually an entire full body. Our kind of customizations are the foundation class, which is for somebody who's never set foot on a piece of Pilates apparatus. You definitely need to start there. And you know, some people take just one foundation class and they're pretty good movers and they get the hang of it quickly and they can transition out into like an all levels class. Some people are in foundations, you know, by choice for 10 classes. It just really depends. And our teachers will help you make that decision. Like, you know, do you think I'm ready to leave? Do you think you know, because one thing we are very crazy about here is safety and doing things right. You know what I mean? Like, yeah, safety, yeah, because you don't want to get hurt. But like, you know, if you're spending your time and your money and your effort, you know, we want to make sure you're really, you know, getting the most out of it and doing it the right way. And then, yeah, we go up, the classes go up to intermediate and we have a few advanced classes. And then of course we have the bone density classes. Those are our most specialized classes for for the bone density groups. Yeah.
Oh, I didn't know you had that.
Yeah. So those classes are specifically for people with osteopenia or osteoporosis. And then we do privates too. So that's the best way to customize, to do, you know, to have a one-on-one session. And then of course we do our physical therapy, which by the way, is covered by health insurance if you have a doctor's referral. So you
Is
can
that
be doing,
new?
That's
yeah.
Is that
awesome.
So you can be doing Pilates, but you know, the doctor doesn't have to write Pilates-based physical therapy. The doctor is going to write, you know, you go to your doctor, you're like, you know, doc, my hip has been killing me. I want to try physical therapy. Please do not let them start with a pill. Please advocate for yourself and say, I want to try something natural and that will give me long-term health. And they just have to write, you know, hip pain, physical therapy, and that referral will cover that. We can do the evaluation and kind of try to get to the root cause of like, why are you having hip pain? And that's if your doctor might send you for an x-ray, your doctor might send you for an MRI. It depends. We get patients in all stages and phases, you know, before surgery, after surgery, instead of surgery, all kinds.
That's
Yeah.
amazing. Did not know that. That's good to know.
Yes. Yeah, that is good to know because the thing with physical therapy is it's not a one-time fix. You know, it's not like, okay, I went to physical therapy, I had a session, I'm better. You know, my
Right,
patient
right.
would say, well, how long do I have? You know, because we always give homework. We always have the treatment, and our treatment will always include a lot of getting to the bottom of what is the root cause of the problem, because so many times, you know, okay, my right hip hurts, but actually, you know, my right hip hurts because, you know, the left side of my spine is restricted. You know, your symptom is many times not the real problem, right? So our team spends a lot of time getting to kind of to the root cause of that problem, and then using manual therapy techniques, but mostly corrective exercises to kind of, you know, unlearn whatever bad movement pattern you've got and relearn a better pattern that's going to resolve the symptoms. So we do heat and ice and ultrasound and e-stim, but those are all pain management techniques. That's going to make you feel better for a temporary time, but it's not going to solve the problem. So I was saying we give all our patients homework, and our patient, it's like, oh, I'm better now, so I don't need to do my homework anymore. It's kind of like the dentist, if you want to keep your teeth, you're going to keep brushing and flossing your teeth. So if you want to stay well, you're going to keep working on your muscles and your joints, and you're going to keep going, right? You're just not really, okay, I'm better, I'm going to stop. So I always get a laugh out of that.
Yeah, like when they say showering, you got to do it daily, right?
Right.
So
Yeah. Please.
you don't get there and forget it and then stop. Yeah. Um,
Exactly.
so mind-body connection and Pilates, right? We often hear in menopause that women can't focus, we've got this brain fog, they lose their train of thought. And you mentioned that Pilates can strengthen perception and in terms of space, right? So I
Right.
think you call that proprioception.
Proprioception, yes. Proprioception, yes.
There you go. But how does do you think that Pilates could also help to get people to refocus and help people with that side of
Yeah, I
menopause,
think
or am I
so.
reaching or am I overreaching?
Yeah, and I mean, and some of the research I've done on menopause, like I said at the beginning, like, we're now the queen of ourselves, and or some people call it, lifting of the hormonal veil, because we're now, we're still nurturers, and we still I still very much want to be a nurturer, but like I said, we're our our phase in life has shifted, and
Yes.
yes, with the brain fog and all those things, but the changes are bringing around new rewirings of the brain, which is really exciting. And I think that's why, we see a lot of women at our phase and stage start new things, new ventures, new jobs, which, is great. So I think putting your mind to something, and Pilates would be a good example, because the teacher is going to guide you, and now we're going to do this, and Natalie knows because she's come to classes, we use a lot of imagery. We say, for leg circles, imagine you're moving your legs through whipped cream, and that's gonna speak to like how you move your legs and the pace of how you move your legs. And so
Right.
things kind of help bring you into the here and now. And maybe you hopefully you're leaving a little less foggy and a little bit more
Yeah.
focused. And we know when we look at meditation, which is why it's recommended that we meditate. I don't know what was the official scientific number. I think it was 7 minutes a day, is because a wayward brain that has a lot of stuff going on in there is psychologists say it's an unhappy brain, right? Because there's so much stuff in there,
Mm.
you know what I mean? It's like in a constant state to
Yeah,
so
yeah, yeah. Monkey mind.
right, I think that anything that can just make you focus and present, and I think that's always a good thing.
Well, I definitely think that it's as you talked about retraining the brain. I mean, I'm a mindfulness coach, so I do understand the whole, being able to be in that present moment. And the fact is, when you when you're on this machine, you really have to focus. You can't be thinking about your grocery list or the tax office, because you might have a spring fly off here if you let go this.
Oh yeah. Yeah. Oh yeah.
So
Yeah.
to me, that excites me, that in that time you are completely focusing on everything. So you're training your brain to.
And yeah, absolutely. And a lot of some of the exercises, you maybe you need to do a little balance, or you need to stand on one leg, and
Yeah.
you stand on one leg and do something with the other leg, push on with the other leg. So yeah, you definitely need to be 100. You need to be thinking. You
Need to
can't.
be
You
there.
need to be
Cannot run
present. You
autopilot.
definitely need to be present. Let's talk a little bit about balance, because that's a big thing I know with menopause. I mean, a lot of women have ringing in the ears, and some people have had, the whole foggy brain thing. Let's talk a little bit about balance. Is that physiotherapy? Is that Pilates? How do we get that balance back?
That's both, because it's different reasons for having poor balance. But I'm going to start again in my favorite place, the feet. You know, I don't know. I mean, there's been and going to be a huge shift of footwear, right? Because you know, our feet are not meant to look like this, right? Our feet are meant to have a nice splay. Like when we stand barefoot, and we just relax and we stand and we look down on our feet, healthy feet have space between all 5 toes, right? So yeah, so if I have a back patient and that back patient comes in and I say, okay, we're going to take off your shoes and socks. They're like, why? I'm like, because I want to, you know, I need to see when I ask you to do X, Y, and Z, what's going on with your feet and what happens with their toes. You know, if you're barefoot and you're doing a squat or you're standing on one leg and you see your toes kind of grip and do something like that, that is a sign of weakness somewhere up the chain. And that is going to very severely impact your balance, because balance is good when your toes are wide and you've got a lot of surface area on the floor. That's when your balance is going to be good. So
pointy toe shoes are out, is what you're saying.
and I love them, but yeah, they're out. I mean, maybe if you're going special occasions only, but definitely like, yeah, I mean, I wear barefoot shoes now with what non-negotiable is the wide toe box. Definitely, that's, you know, padding or cushioning, that's fine. But the non-negotiable is to have a wide toe box, so your feet are not smushed, because then all the tissues between the toes,
Yes.
when you're out of your shoes, and I said, you know, as I suggested, you know, stand on your feet, look down, and if your feet are still like this when they're relaxed, then over the years, those tissues have become short, you know.
Wow.
Yes.
Well, that's one thing that I've suffered with my menopause is definitely feet pain. That's a big thing. As you get out of the bed in the, you know, to go to pee at 3 o'clock in the morning, it's like you're walking on glass
Yeah,
when you
that
get
might
to the bathroom.
that might be a little bit of the beginnings of plantar fasciitis.
I think I do have it. So
Yeah.
I'll be coming to see you, my girl.
Come see us. Yeah.
I'm
I
coming
was
to
gonna
see you.
say, it sounds like you need to go see Summer.
Well, I've been to some of it before, but I definitely, it's time for me to come back. So let's talk a little bit about aches and pains, because that's been a big thing for women
Yeah.
and for myself included. You know, this tendonitis, it's the shoulder, it's the neck, whatever. So we're not running to the physiotherapist every week. What are some things that we can do to help ourselves at home? What are some basic exercises that we could do to the hip, maybe it's the shoulder, you know, to try and get that?
Right. So posture, the best posture is the next posture, right? To move often, to change positions often. So I had a patient last week. She was super excited. She's doing so well with her back pain. She's in corporate, so she was sitting all day. So I said, well, maybe you should get, you know, let's get a standing desk so you can sit, stand, but you also have to do other things as well. So she replaced 8 hours of sitting with 8 hours of standing, which are just pretty much equally as bad as each other because they're both static positions. So what is really going to help us the most is variety of movement, right? Something as simple as getting down on the floor, getting out your mat, getting down on the floor. People, I know exactly. People are like, what? I gotta get down on the floor. Just the tissue mobility and the joint mobility of the action of just getting down onto the floor, doing some, you know what I mean? That in of itself is going to be a great thing. So I can definitely do a little video of maybe some, you know, down and dirty 4 things for you guys that you guys can post, but there are definitely some things like mermaid, you know, the mermaid stretch.
Yes.
You know, that's not
Yes.
something that we do really ever unless we're doing mermaid stretch, right? And that checks a lot of boxes. And all the people in our class are like, why do we have to do mermaid? I don't feel it. But that's working on thoracic spine mobility, shoulder mobility, posture, the position of your hips while you do mermaid is one hip is internally rotated, one hip is, so that's like checking like, you know, 6 boxes with one exercise.
So many boxes.
Yeah.
Yeah.
And
yes,
I
we
like
love that video. Thanks. We love that tutorial. Yeah.
I'm very,
It just feels so good.
yeah, I'm very pragmatic. My workouts are short. Like, you know, my gym, my weightlifting is 35 minutes max. You know, just some good choices of good exercises that give you a lot of bang for your buck. So with in terms of at home helping yourself, definitely a quick little routine every day can definitely help you feel better. And I'll do the one in the video that you asked about the pelvic floor as well.
Perfect.
I'll include that one.
That sounds great. That sounds great. That sounds great. What else do we have to ask Summer about? Where do people get these? Like, how would you go about getting a bone density test? Like, where would I be going, and when should I be looking at that? And there's so many things to do and so many things to get done.
Trust
when
me.
When should I be looking at that one in particular?
You should be looking at that one around perimenopause, because it would be nice to know before, during, after, like
Okay.
what are your bones doing? Because you want to be able to act on that
Yes.
quicker than, oh shoot, I've had this for 10 years,
Right.
I should know the answer to this because we have so many patients that have bone density tests, but I know that not very few places, and not very few, but there are a handful of places that do them. I want to say the women's place, your gynecologist should be able to, tell you also where to get one.
Okay.
Yes, but I should have known the answer to that. And I actually meant to open one of my patients' files and look to see where that referral had come from. So I'm sorry I don't have that information for you, but it's a good thing to get, and very useful for us because it guides your care. So it will also guide, even if you're not coming to Pilates, even if you're not coming to physical therapy, your trainer, your personal trainer, you should be aware of your bone density.
Yes.
And be able, even if right now they're like, I have no idea what that means, you need to say, well, you need to get on the internet and you need to get acquainted
Up level that
yeah. So
a quick Google search has revealed things like Apex Radiology, Elite Diagnostic.
Right.
So it seems to be like the X-ray places that we already know.
Yes, exactly.
They tend to do, okay, interesting. Did not know that. So that's good. And obviously you need a requisition from your doctor in order to do that.
I believe so, but definitely worth it. And, I think it's a really solid piece of information to have, because it guides what you do and how you do it.
Right. And the statistics are a little scary. Like when you see the stats about people who fall after 65 and break a hip, and the correlation between that and their mortality and how soon after those people pass, it's a very scary statistic, and it really too late? Is it too late for us if we are perimenopausal? Is it too late for us to start doing things to work on our bone density? Did we miss that?
No, definitely not. Okay. So, I mean, like there's, and of course, like any other thing, there's always new research coming out, right? So things like weighted vests, like if you're going to do like a walk, some people with low bone density can have a weighted vest. Of course, I think it's based on your BMI and how much you weigh and things like that as to how much weight should be in your weighted vest. But
right.
The other thing is, if you have an osteoporosis patient that goes around like this, you do not want to put a weighted vest on that patient because that's just going to pull them more into that position, right? So you want to make sure they're, nice and vertical. Yeah. So definitely never too late. And because there's so many things to be done now,
There's so much life left.
Exactly.
Yeah, so in chapter 2, I told you we're just getting started, ladies.
That's right. Yeah, I think
Other little things we can do at home that include things like skipping,
planks to load the wrists, So it's the small joints that get affected, like the T-spine is kind of, the lumbar spine it's interesting because a bone density test doesn't really test the T-spine. So for me, if somebody comes with a test and their hip is osteopenic, which is the precursor, I'm just going to assume that the smallest part of their spine definitely has osteoporosis, because if their big joint is looking that way, I'm going to just say that, you know, your the finer, more delicate parts of your spine, if your big, strong joints are moving this direction, imagine what your smaller joints
Right.
are looking like, even especially if they're a sedentary person and doesn't, you know, do anything,
Yes.
you
Yes.
know. So yeah, so I am pro movement, and think that, you know, movement can really help people in a multitude of
Of yeah. Is it painful, the bone density test? Have you
No,
had one or something?
no, I have not had one yet. I need to have one.
Okay.
No, but it's not. I think you put your foot in something or your hand in something. Yeah, it's not painful at all.
Okay.
I'm definitely
You
going to
know,
go
that
into.
makes people not want to do it.
I know, 100%. 100%.
You know, what is amazing to me is, you know, certainly from this discussion, is with menopause, we talk about the big boys. We talk about, when I say that, we talk about the small boys more than we talk about the big boys. So the small boys, what I like to call, would be like your hot flashes, your mood swings, this kind of stuff. But the big boys are your joints, your bones, your mobility, your balance, your heart, your
Yeah,
liver, your kidneys. That's what I call the big boys. So whatever we can do to make sure that those big boys still stand strong. Guess what? Hot flashes, we can turn the fan up, we can turn on the
right.
AC, we can do, those are easier fixes then
100%.
if we don't tackle the bones and the joints from
Joints. Yeah.
now.
Yeah.
And that I think is super important.
Yeah. And I think, you know, because you know, and I'm encouraging all women in this phase, you know, we're at a stage where we should be taking more time to notice how we feel, you know, like, you know what I mean? We should not be like, oh, I'm just going to put, you know, like, I'm just going to push that to the side. So we should be taking more time for ourselves and say,
Mhm.
look, you know, if I have this thing going on and there's maybe something out there that can help me, then why wouldn't I? What is the barrier what is the barrier between, you know, maybe asking a professional for some help here, you know? It's
Without
like,
a doubt. I mean, the thing is that I think also for women, you know, and we go to our doctors, and we've had this in previous things where we're dismissed. So you have this, you have that, or the doctors will come up and say, "Oh yes, you have, I don't know, tendonitis, or you have whatever." But the thing is, as you said, if we're not aware of what is going on in our body and speak up about it,
right,
then we cannot address it. But being able to have the facility of coming to a physiotherapist or a Pilates class to try something new and different rather than popping a pill, which is another big thing that doctors love to do. Oh, you're having aches and pains, you go on an anti-inflammatory, you take Advil, or you take whatever.
right,
That then is going to possibly mess with the stomach, and on we go. So
right.
why not start with
Yeah.
what I call the drug-free treatment then of
So we call that drug-free treatment. It's like long-term health, you know, like the long-term health. And, you know, we've seen so many times in clients and patients who've come here that, you know, walked in and can do so little and are so hopeless. And you know, you see them again in, you know, 3 months, and it's like a different person, because when the shift that happens when, like, oh my God, I thought that I'd never be able to do this again, and now I can do this again. You know what I mean? It's a big deal, and probably makes a huge change in their life and their attitude and their hope. You know what I mean? You know, that potential of like hope. I don't have to live like this. You know, there's hope out there for me, and I can relearn to do this. Or so it's exciting.
it
All
is
about help.
exciting.
Yeah.
Yeah, but also we as women, we tend to sort of dismiss things, you know, so, or you go to a doctor, or we do it ourselves. Oh, you're having a back pain, or you hip, you say, oh God, it must be menopause. How many women have we heard say this? I know I've done it in the past. Oh, you're having so and so. Oh, here we go. It must be menopause. But truthfully, we don't have to live with it.
No,
Right.
We
Right.
don't. We go to
no.
a doctor. We go to a health, you know, person, a nutritionist. We go
Sure.
to, you know, somebody who's going to help us with the mind, the hair, the eyes, everything, the teeth. It affects
Yeah.
every part of us as
Right.
women.
And there's so many great experts like you guys out there to help. You know what I mean? So
We're just calling awareness to the situation.
yeah, yeah,
You know, because for so long, menopause and the related issues that come up were taboo. People, women, you know, we're strong and we're silent. Yeah.
yeah, yeah.
So we bear it and we don't show. But I think it's time to put an end to that, which is really, that's the purpose of these talks, to say, look, we're all going through something. And no matter what it is that you're going through, because it can be any of these 62 issues,
Right,
there's something out there to help. You know,
right,
there's something
right.
out there to help. We don't have to keel over. We don't have to die. We're not old and decrepit. We're
No,
still vibrant. We're still beautiful. We're still functional. We're still contributing. We're
right,
still all of this stuff. How can we just be better
right.
at it? You know,
I will say we have a lot of, and I'm sure you all do too. A lot of women are like, oh my God, you know, I hit menopause and I gained all this weight. Well, what is
yeah,
happening? You know, like, and then people always ask us, will Pilates help me lose weight? And so we're not, that's not our area of expertise at all. We're
Mhm.
into function. We're into, are you strong
Right.
enough to go up and down the stairs? Are you strong enough to get onto the floor to play with your grandkids? If you're an athlete, are you strong enough to play your sport and not get injured? But, you know, we know enough to say, are you moving enough? Are you
Yes.
moving in the right ways? Are you eating enough protein? Simple things like that, you know, because a lot of the women that we have here just, you know, they're eating because their weight is going up, they're eating less and less. When in fact, probably they need to eat more of just different things.
Better choices. Yeah.
Yeah. And more, yeah, of different things. Yeah. So yeah, there's so many things you can do, and there's so many actions you can take. And I just think even just taking one action or two action is just such a step in the right direction, that just like, yeah,
Yes.
that's just the little thing that they needed to get them rolling.
Yes. Yes. Yes.
Without a doubt.
Absolutely. How do people find you, Summer?
They can find us on Instagram, Body Forte LTD, or Facebook, same thing.
Okay.
Or we have a website. If you just Google Pilates Jamaica, we should be there. I hope that number for that search, we better be. So and we're at Sovereign Commercial Center, so very conveniently located right here in Kingston 6. Yeah.
Okay. Great.
Definitely. Well, when I send out the replay video, I will include all of that information,
Thank
your
you.
website, your phone
Awesome.
number, your all of that good
Good
stuff
stuff.
for people to check it out, because I really truly feel that this is a great stop for us. When I say that, meaning we go and get our hair done, we go get our nails done, we go and do all of these things that we think, oh, we got to do, which is important, but
Yes.
maintaining our bones and our balance and our muscles through this change, as I said, it's like puberty. And I think one of our doctors did speak about it in past episodes, where it's like we're going through puberty again, where hormones are all over the place, your body is changing, your muscles and your bones are changing. It's like, so why not do
Yeah,
this?
I think that doctor was alluding to that whole rewiring process, just like in puberty, that whole rewiring process that's happening right now, which is as the very exciting thing, you know, if you're open to it and you have the right frame of mind, and it, you know, you look at it as a positive thing versus, oh, you know, it's over. Not
Yes.
so.
Just the beginning. I mean, as I always say, and I've said it in so many posts, and I will continue to say, that menopause is inevitable, but suffering is not.
Right. Exactly. It's like going to the dentist and say, you can take my tooth out and I don't need an injection. Why?
Yeah, exactly. You don't get points for suffering.
No,
This is
no,
it.
no, no.
But
I'm
yeah,
wondering if
yeah, does anybody have any questions?
that's
If not,
exactly what I was wondering. Yeah. So we know
anybody?
Summer's got patients and clients and classes and all sorts of good stuff.
Is there anything else you
I'm
would like to also share with us, some of that maybe that we haven't touched on?
I am looking at, I made some notes, but I think we hit all of the ones that I was keen to talk about. Yeah, I think we hit all of those topics, and I hope people found it helpful, and I hope people will, you know, get where'd you guys go? There you go. Yeah, reach out for help if needed, you know, or even to ask a question, you know, send an email, ask a question. Like you guys said, we have such a great community now of people who are here to help, you know.
And go get your bone density test done. That is what I know I am going to be doing.
Yes, go get your bone density test done for sure. And
Summer, you haven't gone. You and I should go together. You haven't gone. So
I know.
I
I actually do need to go, but like you said, you're saying there's so many things, right? Like I feel like I'm always behind on my blood work, this and that. I'm like, oh, it's that time of year again. Holy cow, how did that happen?
Absolutely. Well, just scheduling everything. Well, I think we talked about some great stuff here, ladies. I really do.
Yeah.
Well,
Summer, thank you so much for sharing your precious time with us.
Thank you so much for thinking of me. And like I said, I think it's a great and wonderful thing that you guys are doing. You know, connecting and making a great community of women. So well done to you guys.
Yay.
We're doing this together, girlies. So thank you so much, Summer. I know you have to rush and go see patients, and I will send out the replays for those who couldn't.
And I promise to send that video to you. I'll share it via the drive probably by tomorrow afternoon.
That would be perfect. Awesome. Yep, and I can always include it in. All right, ladies. Thank you so much.
Bye.
Bye, everyone. Thank you so much.
Take care.